Working to solicit public input on shaping our next steps in Vermont's emerging healthcare reform environment, Blue Cross and Blue Shield of Vermont met with business leaders and community decision makers around the state to get their insight and opinions. With an agenda of conversation, breakfast, a brief presentation, and discussion, a team led by President and CEO Don George discussed many issues, hoping to gain perspective from individual and group healthcare consumers.
Well, that we're an independent Vermont company has a lot to do with it, because we can make the decisions, we can make them for Vermont. We say we're obligated to communities. That's part of why we're here today. It gets back to the industry that I say, the health insurance industry. The industry I often refer to is the one that I'm associated with but not part of. And the reason why I think that the federal health care insurance reforms, the reason I like them, even though a lot of these things are already being done in Vermont, either by law or by Blue Cross Blue Shield business practice, is that I have a tired exhale every time I sit down in the evening and you hear a horror story on the news about some for-profit company that did something to somebody in some state. I was meeting with a customer of ours, and I'm sure he would be okay. He's on our client advisory board, and mentioning him, it had a 4% renewal increase. And so when I went into the meeting, it was the first time I'd ever met with them, and I was just out meeting with as many customers as I could. I said, it's a 4%. I went in there pretty sanguine on this. Our trends are 8, he's 4. And it was a good first customer interaction to have had, because the president said, 8 is the average. 4 you think is great. My suppliers are going up 0 to 2. And I learned then, if I hadn't known before, to emphasize 4 may be great, but we need to endeavor to get down to the same rate of all consumer CPI. And I think that ultimately ought to be the goal to where we go. Well, the other thing is to make health and wellness a system priority, and to make it a priority in a way that we haven't in the past, and that is by obligating all of us to be more personally responsible for our own health care. And by that we mean at Blue Cross of Vermont and among our customers that we're working with on wellness programs, we say that all of us should know our numbers. And by that I mean we all should go through biometric screenings on an annual basis. Get a printout and understand our vital medical statistics. And if we're well, understand and engage in habits that will keep us well. And if we have a condition, understand that condition well and be able to live with it well and interact with our physicians and live as well as we can within that condition. So all of us taking more personal responsibility we think is important. Which brings me to Blue Cross's new vision. It is a healthcare reform vision. It's a vision for comprehensive healthcare system reform. And it's quite simply a vision for a transformed healthcare system in Vermont, in which every Vermonter has health coverage and receives timely, effective, affordable health care. And the reason that we like this vision is that it obligates us to the whole solution and not just our little corner of the world. And it's a constant reminder of the challenges that lie ahead, and the need for change, and the fact that all of the stakeholders are going to have to work together to accomplish it. The reason I like this vision is that if I think back on the 25 years I mentioned I've worked in healthcare in Vermont, the accomplishments during that time that I've been involved in, I have said to groups as I spoke to them like yourselves that I can best characterize them by, at best it was 1 step forward, 2 steps forward and 1 step back. And many times it was 1 step forward and 1 step back. And unfortunately, on many occasions, there were no steps at all. And that's why we're really believers in comprehensive health system reform, and all of the stakeholders are going to have to work together, view their roles in new ways, and advocate for the whole solution, and subordinate their own little self-interest if they have to. And I'd offer that Blue Cross is willing to do that, and I'd offer that you all ought to challenge us, and as I continue to stay in contact and dialogue with you, challenge me that I'm really doing it, because I really do think it takes the stakeholders individually working together in order to accomplish this. Really at the heart and soul of our new mission is what we call our commitment to outstanding member experiences. When you think about the healthcare system today, both the financing and the delivery of care, the people who are accessing and using that very likely could be coming to Blue Cross of Vermont or the delivery system during a time of great personal anxiety and stress. They have a major health condition episode in their life. One day they're well, the next day they're not. And then the other fundamental reality of that experience for them is that the system is not exactly easy to use. Now, you consider both of those things and also consider that those they're turning to, their health plans, that industry is being depicted today as very cold and impersonal. So it's a time of great stress, it's a confusing system. Those they need to rely on as they turn to, they have a strong sense that these people are cold and impersonal. And that's why within Blue Cross of Vermont, we've turned to our employees and said, because we're local, because we're independent, because you're Vermonters serving Vermonters, the reality is you have to make this highly personal. And I can tell you, I've had a really strong group to build on. These are folks that were known for their service excellence, very committed to all of that. What we're saying is we want to take it a step higher than that. We want to make every interaction people have with us as absolutely positive as we can.
While the challenge ahead is great for the entire country, we hope that here in Vermont, we may transform our healthcare system into one in which every Vermonter has healthcare coverage and receives timely, effective, affordable care.
Blue Cross and Blue Shield of Vermont, the signs of a healthier Vermont.